The nurse taking care of a 15-year-old male wrestler at a primary care clinic who complains of a raised, red, ring-like rash with central clearing on his lower back that he states is very itchy. Which of the following is the most likely diagnosis? A. Tinea corporis. B. Tinea cruris. C. Tinea capitis. D. Tinea menuum. E. Tinea pedis. The answer is A. Tinea corporis. Tinea corporis is also known colloquially as ringworm. The described case is a classic case for tinea corporis, in which the patient is a young athlete, often a wrestler, due to the frequent skin-to-skin or skin-to-mat contact in damp, sweaty environments, who presents with an itchy, red, ring-like rash that exhibits central clearing. The word corporis qualifies that the fungal dermatophyte infection, tinea, is specifically located on the body/torso/back region. The other choices are incorrect, as tinea capitis is a fungal infection of the scalp, tinea pedis is a fungal infection of the feet, tinea cruris is a fungal infection of the groin, jock itch, and tinea menuum is a fungal infection of the hands. You are a nurse in an emergency department and a patient presents with a 5 cm by 6 cm abscess on the dorsal aspect of his left hand. The hand is very painful, but he has full range of motion, and no sensory deficits. He is febrile and has no systemic or localized symptoms aside from the abscess. Which of the following is the most appropriate next step in management? A. Prescribe oral antibiotics without draining the abscess. B. Inject steroid into the abscess. C. Amputate the affected hand at the wrist. D. Apply topical antibiotic to the abscess. E. Incision and drainage of the abscess. The answer is E. Incision and drainage of the abscess. An abscess, by definition, is a walled-off collection of pus and bacteria, that is typically impenetrable to topical or systemic antibiotics. The only way to truly resolve an abscess is to incise and drain it, such that the walled-off material can be expelled, and the pressure and pain can be relieved. Further, the material should be sent for culture so that the patient can be placed on appropriate antibiotics if the physician deems it necessary for post-drainage care. The other choices are incorrect. Surgical amputation of the affected hand would be a drastic measure for a localized abscess that is not otherwise causing limb ischemia or necrosis. Incision and drainage is a much more reasonable first step. Injecting a steroid into the abscess would be a potentially dangerous intervention, as steroids decrease the body's immune response to infection, and as such, could increase the bacterial load within the abscess, allowing it to expand and become more serious. As mentioned earlier, topical and oral antibiotics would likely be impenetrable to the abscess and would be inappropriate first steps when the option of incision and drainage exists. Which of the following causes microcytic hypochromic anemia? A. Chronic lead exposure. B. Iron deficiency. C. Thalassemia. D. All of these. The answer is D. All of these. All of these result in microcytic hypochromic anemia, which is a type of anemia characterized by small red blood cells called microcytes that contain lower concentrations of hemoglobin than healthy red blood cells. What is the most significant risk of hyperkalemia? Elevated serum potassium. A. Rhabdomyolysis. B. Sudden cardiac death. C. Respiratory depression. D. Weakness, tremors, and cramps. The answer is B. Sudden cardiac death. Mild hyperkalemia may be asymptomatic, but a significant rise if potassium levels above normal can cause fatal heart arrhythmia, resulting in sudden cardiac death. Weakness, tremors, and cramps are common symptoms of mild hypokalemia, depressed potassium levels, while respiratory depression and rhabdomyolysis can occur with severe cases of hypokalemia. Cranial nerves are important to assess to determine the neurological status of a patient in regards to possible deficits. All the following cranial nerves should be assessed for proper eye movement and function, including vision except dash. A. Cranial nerve 6. B. Cranial nerve 8. C. Cranial nerve 3. D. Cranial nerve 2. E. Cranial nerve 4. The answer is B. Cranial nerve 8. Cranial nerve 8 is the vestibulocochlear nerve responsible for hearing and balance. It does not control the eye. Cranial nerve 2 is the optic nerve, control vision and acuity. Cranial nerve 3 is the oculomotor nerve, which controls eye movement, pupil reflex, eyelid, and proprioception. Cranial nerve 4 is the trochlear nerve, which controls extraocular eye movement, as does cranial nerve 6, the abducens.